Welcome, everybody. My name is Dr. Norbert Goldfield, and as always, it's a pleasure to be with a number of you. This is kind of the beginning of our season. 2026 is nothing short of a critical year, as I'm sure all of you are aware. Um, and It's cold here. I'm not sure if you can see, but I got a fire going here. And we have 2 feet of snow outside. I recognize some of you who are living in warmer climes, but it's wonderful. Have had wonderful hikes already, and look forward to more. And it certainly got my exercise today. Um, what I'd like to do is introduce our speakers, and we're going to have a third speaker who will join us in a few minutes. The third speaker is going to be a new speaker. It's not going to be the speaker that I highlighted for you, and that's part of the joy, but I'll say more about that in just a few minutes when I introduce our new speaker, who will be another congressional political candidate. Um, I want to first of all introduce Suzanne Gordon. She'll be our first speaker. Then Sarah Hughes will be our second speaker. Suzanne, I've had the pleasure. This is one of the many wonderful things about doing this kind of work. You meet wonderful people, and I've been reading about her work both in the American Prospect and in most recently, I read an article by her in Barn Raiser. She's an activist. She's an expert in the VA and what's going on in the VA. And I guess if Ask Nurses and Doctors is to be successful, we need to be very interested in aspects of healthcare in rural areas. And one of the critical aspects of rural healthcare is the presence of the VA. I live in Northampton, Massachusetts, which is a small town. There's a VA here. We're under stress, and we look forward to hearing from Suzanne over the next 10 minutes. What is her perspective on what Ask Nurses and Doctors can do and what we all can do, and just to be aware in a way of what's going on with the VA under this second Trump administration. Thank you so much for joining us today, Suzanne, and I'll
Thank
let
you
you
for
take
having
it
me.
over.
And you want me to begin?
Yes, please
Okay.
do. Nothing like the
So I
process.
think that the most important thing that us nurses and doctors can do is to educate yourselves and other nurses and doctors and healthcare workers and healthcare reformers about the VA, because the VA is our invisible healthcare system. I mean, very few people know what the VA does, and what they think they know it does. Even very smart healthcare reform activists is often absorbed by it's stuff that they've absorbed from the mainstream media, which has been heavily influenced by the Koch brothers and their efforts to destroy the VA, and also corporate healthcare institutions, who are really just thrilled to get the billions and billions and potentially trillions of dollars that is in the public coffers, that they would like diverted from their coffers. So, um, one of the things that's fun about the work that I do is talking to progressives. It's challenge, but it's fun when I'm able to overcome my desire to punch them in the nose. Um, who tell me, "Oh, but the VA is so awful." Because they've heard it on NPR or read it in the New York Times. And I get to say, I understand why you feel that way, but let me tell you about the VA. It's kind of like when I worked with nurses for decades, and somebody would say, "Oh, nurses, um, why would it, oh, you're just, bedpan emptiers." And you'd get to say, "Let me tell you what nurses see in bedpans," and have a lot of fun doing that. And the VA is not only our largest healthcare system, it's our most successful healthcare system. It delivers better care at lower cost to veterans. And it not only serves veterans, but it serves the entire public through its teaching mission and research mission and emergency preparedness mission. Yet often, I mean, I was talking to, I don't know if this was fun, but it was fun just abusing this person. I was talking to a very prominent reporter, and I said, you should cover VA research and how the Trump administration is cutting back on VA research. And he said, VA what? And I got to tell him, gee, the VA is the second biggest powerhouse, research powerhouse after the NIH. And, think the first implantable cardiac pacemaker, think the nicotine patch, think, barcoding, think, I mean, it's just astonishing what the VA does. So we have a huge opportunity to educate ourselves, doctors and nurses. I mean, a lot of doctors, but particularly older doctors, will tell me, oh, but I worked in the VA and it was kind of a mess. And I said, well, when did you work there? Well, I worked there in 1985. And I mean, it's not, that was a long time ago. And the VA has transformed since then. Now they're trying to transform it back to Born on the 4th of July. They're trying to privatize it and trash it because it's so successful and the quality of care is so well. I mean, just think about it. The Koch brothers wouldn't be spending, $12 million a year to try to trash the VA if the VA care was trash. All they'd have to do is go like that. They're trying to trash it because VA delivers such high quality care, and they're trying to make sure that it can't do that. And that's what we're seeing. We're seeing an administration that is determined to defund the VA, to destaff the VA, to create a hostile work environment. The VA used to be a really great place to work. And in some places it still is, amazingly, but not, they're trying to create a hostile work environment. They're trying to create a lack of psychological safety. Nurses and doctors know how important that is. They've abrogated union contracts and denied workers a voice, which is not a labor management issue. It's fundamentally a patient safety issue, because if a nurse can't tell a reluctant doctor, or a doctor won't listen to her or him, that you can't, you're giving the wrong med, or you're giving the wrong dose or whatever, for fear of retaliation, then a patient could die. And we have data on how, I mean, and people on this call know that lack of psychological safety in the workplace can kill people when the workplace is a healthcare workplace. Now, I really want to, because I don't have very long to talk to you, I really want to talk about the opportunity of the horrific death of Alex Preddy on Saturday, Alex Jeffrey Preddy, who was a nurse who, like many of the citizens in Minneapolis, like 50,000 other citizens, went to a demonstration to protest the ICE presence in Minneapolis and the death of Renee Good. Alex Preddy was filming the behavior of the ICE agents, but that's not why he was killed. He was killed as a nurse, because he was fulfilling his oath as a nurse, because some woman near him got pepper sprayed and knocked down, and he was trying to help her. The very last words out of Alex Preddy's mouth were, "Are you okay?" And he was murdered by ICE agents. And this is so tragic. It's beyond words. But, because they killed a white mother of three and now a white nurse, I mean, they killed the wrong guy, and they're trying to demonize, the administration is trying to demonize Preddy's memory like they demonized Renee Good. Only it's kind of hard to turn a VA ICU nurse into a terrorist, right? And this is not going down well. And hopefully the Democrats are going to vote to defund Homeland Security. Um, but and these ICE agents, or at least ICE. But I think this gives us, anyone who's a doctor or a nurse, gives us an opportunity to talk about, meant about the assault on the VA, because many VA workers, and I have an article about this coming out tomorrow in the American Prospect, and I would suggest that you look at it. And it's just the American Prospect, and then it'll be up on our website. And before I leave, I would encourage all of you also to to sign up for our free newsletter at the Veterans Healthcare Policy Institute. But any one of us who's fighting for an equitable healthcare system, a national healthcare system, has to be opposed to VA privatization, has to learn how to rebut arguments that are out there about the VA and how bad it is. And really now has to talk about, they're now killing VA nurses and what this man stood for. And he made sacrifices as a nurse to work at the VA, because nurses at the VA do not get market rate salaries. And they deal with very complex patients, some of whom are dangerous. I mean, the guy who killed Renee Good was a veteran. And who knows if the guy who killed Alex Preddy was a veteran? Homeland Security and ICE are recruiting veterans, particularly combat veterans, many of whom have traumatic brain injuries and PTSD, like the guy who killed Renee Good. These people should not be armed. They should not be put in combat like situations. It's not fair. It's not just not fair to us, it's not fair to them. It's horrible to them. And so I think that every nurse, certainly every nurse, should be protesting this, that we should be calling, our senators and our congressmen, and particularly Democrats, to get them to defund this program and put constraints on it, but also Republicans. And I think that we should really educate ourselves about VA privatization, because if you're fighting for a better healthcare system in America, there's no better model than the VA. You don't have to look to Canada. You don't have to look to the UK or Scandinavia or, many other models. You can look around the corner at a system that, when it's well funded and well staffed, gives incredible care, has developed incredible models of care, that I'd be happy to talk about now or another time, that we should all enjoy. I mean, we should all have primary care practices that have psychologists and psychiatric nurse practitioners and pharmacists and social workers and dietitians right there in the clinic. We
I think we should take some
And
time
so
for
I
questions.
basically just want to, I know I need to stop. Um, so I just think that it would be great if folks would inform themselves. And I'd be happy to answer questions. You can also reach out to me at another time. I'd be happy to give a workshop on the VA, whatever. Um, but I want to thank you for having me, and I look forward to any questions I can answer in the short time I have with you.
Thank you so much, Suzanne. I'm going to start out the questions. And then we already have some questions in the chat, and we'll take 5 minutes of questions, and then we'll move on to Sarah Hughes. Um, this work is very hard. So before I ask the more political question, I'd like to ask you, Suzanne, if you could tell me one funny experience that you had in dealing with the VA health system.
Well, I don't know if it's a funny experience. I mean, I wrote a book about VA healthcare. I spent 5 years researching VA healthcare, called Wounds of War. And what the VA does is create a community care for veterans and caregivers. That's what they're trying to destroy. And I remember being in the cafeteria at Fort Miley in San Francisco, waiting to interview a VA psychologist, and I was sitting with a veteran, and just somebody I didn't know. We were having lunch, and he said, "What are you doing here?" And I said, "I'm writing a book about VA." And he just immediately, I didn't ask him a question, I just said that. He immediately said, "Oh, what a great system. And I had PTSD, and I had this great psychologist, and you should talk to this psychologist," who was, in fact, the psychologist I was going to talk to. And then somebody, at the next table, says, "Oh, I couldn't help overhearing you. I need to talk to you. I need to tell you," and he starts to tell me about how he was aggressive and violent with his wife, and the VA saved his marriage. And then some other person is walking by and hands me a napkin with his phone number on it. "You have to talk to me." And I mean, all of us have, I've sat in a million lunch, hospital cafeterias where nobody talks to each other. And it was just like, wow, I couldn't believe it. And I don't know if that's a funny thing, but that comes to mind. And that's what they're trying to wreck. They don't want that. They want us all to be, but autonomous, rational healthcare, economic actors, giving money to the private sector, not human beings caring for one another on the public dime.
That was good. And so now I'm going to ask you the serious question, which is to say, the one of your articles, and it sort of summarizes, is how this administration is, to use your words, giving the middle finger to veterans. Um, and are there one of the messages which doesn't seem to be quite resonating, you know, and maybe it's not that we're not articulating it well enough. One of the messages, I want to see if there's two or three simple messages that we at Ask Nurses and Doctors, together with other groups, could be pushing. Are there other messages, or is that the one we should be focused on? Don't privatize the VA health system, because the VA health system is fantastic. What are some simple messages that you think people could understand, that
Well, I think it's don't privatize the VA. It's don't outsource veteran care to the private sector, and don't defund the VA. And then I think it's the because, right? And because is where you get the kind of messages. And one is because the VA is the nation's only actually genuine healthcare system. Most things that call themselves healthcare systems are really fragmented, episodic disease treatment arrangements. They don't deliver integrated care, and they don't deliver healthcare. And the VA delivers medical care, which is only part of healthcare, and it also deals with homelessness and economic problems and employment problems and socioeconomic problems. Don't privatize the VA, because the VA doesn't only serve veterans, it serves us all. The VA teaches is the hub of the nation's healthcare professional training system. We suffer from catastrophic shortages of mental health providers, primary care providers, and without the VA training 40 different healthcare professionals, our shortages are going to be even worse. And don't privatize the VA, because it's one of the biggest research powerhouses in the country. And don't privatize the VA because it serves us all with its fourth mission of emergency preparedness for, helping out in national, regional, and local emergencies, so forth. Um,
okay? Thank you. I want to cut to these two quick questions, and then we're gonna move on to Sarah Hughes. I want to welcome Dr. Nirav Shah, who will be introducing after Sarah Hughes. Um, from Dale Anderson, what are the major groups trying to defend the VA system?
Great. Thank you for asking that. There's a veterans group called Common Defense, which is launched a VA Not for Sale campaign. There's a group called Save Our VA, which is a Veterans for Peace campaign. There is a group called Unite for Veterans that is trying to be helpful. The unions, AFGE, National Nurses Union, National Federation of Federal Employees, is helping. But one of the most exciting developments is that because federal unions have been pretty tepid and not very militant, the Trump administration assault on the VA has produced something. Sorry, Foster Gueston. Yes, the VA serves us all, right on. Sorry. There's something, and this is the article in the New York Times. The Federal Unionist Network, and I think Sarah, are you going to talk about that? But this is a super important development of people across the federal government that are really trying to act like unions should act, and which, the other, sadly, VA unions have not acted militant enough. I mean,
So I'm going to move on to the last question, so that we can have everybody speak. So I think we got some organizations that certainly ask nurses and doctors, for one, will reach out to. So I think that's very helpful right there. The last question that I'm going to give to you is from Connie Adler, and that one of the areas that the VA in Maine has really championed is dealing with vets with homelessness. Is this true around the country?
oh, yes, VA has reduced veteran homelessness by about 50%. If Trump and Collins have their way, they will. We will see more homeless vets on the street. We will be using more municipal money that could be spent on other things, for homelessness. It's yes. I just want to, if you don't mind, Norbert, I'd like to just say one thing in conclusion.
Please.
It's super important for all of us to be pushing candidates, um, for Congress and the Senate to include VA as a major plank in their programs and in their runs for Congress. Some of them are not, and this is something you can do, that we can all do together. Um, and every candidate should take the pledge, to fight privatization. And privatization isn't just shutting down the VA tomorrow, it's outsourcing, defunding, destroying the VA's architecture. And I think we should also be working very hard, all of us, for what we want the Democrats to do if, knock on wood, I have a very wooden head, we win either the House, or miracle of miracles, the House and Senate, because, the Democrats have not been good on VA privatization, and we want them to be better. We don't just want to breathe a sigh of release. There's a lot to reverse. So thank you so much for having me. I wish I could listen, to other folks. I may listen, I may
You'll get the recording. You'll
not.
get the recording. You'll
Great,
get the
thank you
recording.
so much.
Thanks so much for being on, Suzanne. I think there's no question in my mind, I've already said it, that a perspective of Ask Nurses and Doctors, if we're going to win in November, we have to really focus on rural healthcare. And that's a key aspect of what we're going to do. And the VA is an important part of that. So now labor is another critical part of that. And I'm so pleased to not only welcome Sarah Hughes for the wonderful work that she's done, but there's also a personal connection because she did graduate work at UMass Amherst,
Mm.
and so that's right where I live. And so, Sarah, thanks so much for being with us, and take it away.
Thank you for having me, Dr. Goldfield. And before Suzanne has to leave, I wanted to shout out her book, Safety in Numbers, because I'm going to talk about staffing tonight. And Suzanne wrote the book on how the state of California won safe staffing ratios. So I'm a fan of Suzanne's. Um, all of which to say, she actually, let me backtrack one second. So I work for an organization called Labor Notes. I don't know if anyone's familiar with us, but we are a media and organizing project that's been around since 1979. And we really see our mission as being folks who are covering the stories of workers organizing, which isn't always the same story as what you get from sort of the official story of labor and unions in the US, but we really like to hear about who is doing the work of fighting back against their bad bosses in their unions and their workplaces. We publish a monthly magazine, and we also have a giant conference every other year. We're slated to have our next one in June. And we are going to be turning away. We're going to have about 5,000 labor activists come to Chicago, and we'll be turning away several thousand more if last year is any indication. So we are focused on people organizing and how they can do that more effectively. We believe that strong unions are an absolute foundational cornerstone for any change that we need to see in terms of supporting people and communities. And I cover the healthcare sector for Labor Notes. So something else Suzanne mentioned that really kind of gets to the heart of what I'll be talking about tonight is when someone asked who is out there defending the VA, and Suzanne mentions that VA unions are one of those organizations that have some institutional power to try and defend against these cuts. But she also, I think, couched it by saying a lot of these unions for these federal workers have been very weak. They have very weak protections under labor law, even before they were, Elon Musk doged, the federal sector and did away with their collective bargaining rights. But there are not that many powerful organizations that are able to defend healthcare, but healthcare unions are, or could be, and we think there's a lot of untapped potential here, are those sorts of places where healthcare workers can leverage legal tools like collective bargaining contracts to fight for better conditions in their hospitals and their facilities. And we see them doing that. Only, I would say, something like less than 15%, probably a lot less now, given the cuts to the VA and elsewhere, but less than 15% of healthcare workers are unionized. That is, by and large, nurses, RNs, but there are unionized physicians, particularly in public hospitals. There are unionized residents. The Council on Interns and Residents has doubled in size since the pandemic. There are, of course, a huge number of folks working in long-term care facilities, the CNAs, LPNs, environmental services, dietary, the folks who do the support work in hospitals are also often unionized. But something that weakens this potential for healthcare workers to be able to fight for healthcare writ large is the fractured nature of the healthcare labor movement. If you look at a unionized industry like healthcare, like K through 12 education, there are two large unions that everyone belongs to, and they can often align their programs or at least attempt to have some common program. Other such sectors have some, maybe one or two big unions that kind of can coordinate those activities. But in healthcare, there are literally dozens of unions that represent healthcare workers. Some of them only represent healthcare workers, like National Nurses United, but many others, the service employees, truly everyone. The Teamsters have healthcare workers. The UAW has healthcare workers. Like really, the communications workers. Really any union in the U.S. at this point has shops, as we say, of unionized healthcare employees. Which just there haven't been tremendous efforts for folks at a federal or national level to coalesce around a strategy for fighting for something like Medicare and Medicaid funding at this point. And that's something that we hope to see. Something we think we do at Labor Notes is try to support folks who are attempting to organize for stronger and more democratic unions. We will support folks who maybe have moribund union leadership, that they think is not doing enough, and will help them organize to run for office and try and push for the kind of unions that can make change, that can do that kind of work, fight for patients, fight for workers, fight for communities. Suzanne alluded to the Federal Unionist Network. I was telling her before folks joined that a New York Times Magazine article was published today. That's a profile of this network that was actually a project started at one of our conferences, or they had their initial meeting at one of our conferences. It's the kind of work we support, which is bringing together federal workers across all these unions, NIFI, AFG, all these crazy acronyms, this alphabet soup I'm saying, but pulling together activists and leaders from these dozens of different unions to try and talk about how we could fight together. And you can see in that article, it's a great example of how they've pushed from below, from their membership, exerted pressure on their leadership to then push their leadership to push back against Trump and the administration. And that's something that we support at Labor Notes. How are we helping people organize as members to push back against their own leaders, to give them the kind of backbone and power they need to push back against employers and bad government actors? Norbert, do you have a time check for me? I'm sorry, I wanted to pivot, but
I would say 3 or 4 minutes more.
Okay, excellent. So I'll say that's kind of a broad idea of kind of why we do the work that we do and why we think it's important for healthcare unions to be strong, to be democratic, to be run by their members, because we know that nurses and other healthcare workers want to fight for these sorts of improvements in healthcare, generally speaking. And at this point, healthcare workers are very much in motion. We're seeing some really big labor struggles in the healthcare field lately that I hope folks are paying attention to, interested in supporting, because they will have ramifications for the healthcare industry writ large. One of those I'll point to, I'm here in Brooklyn, New York. 15,000 nurses in the New York State Nurses Association are on an open-ended strike right now. They're on week 3. This is extremely unusual in healthcare. Almost all strikes that happen in healthcare are 1 day, 2 day, 5 day. They'll say ahead of time, we're just going out for this short amount of time. Part of this is about giving the hospital time to find, temporary traveler staffing to make sure that the hospital continues to function. But the fact that they are on open-ended strike is very unusual, and it's risky on both sides, and the outcome is far from predetermined. Those New York nurses, and we're also seeing 31,000 healthcare workers, not just nurses, in California and Hawaii, are out on open-ended strike as well against Kaiser Permanente. I'm sure that name is familiar to folks. Obviously, an enormous both healthcare insurer and provider. Both of those strikes are about, and really all healthcare strikes that have been coming about since before the pandemic have been about safe staffing. Again, Suzanne's book, have been about safe staffing, which is about having the kind of...
Put yourselves on mute, please. Cynthia, could you put yourself on mute?
Oh, things were out of...
Cynthia, could you put yourself on mute?
Oh, I'm so sorry. Okay.
Which is really fighting for this, of course, the ability to not have more patients at an acuity that is dangerous to the patient and the healthcare worker. There are some states have been fighting for these laws to have mandatory statutory ratios. Only California, Oregon, and New York sort of have, I think, actually passed those laws. Maybe but there's been efforts in a lot more states. And even California now, who is the leader in that, is struggling to live up to those statutory obligations in terms of nurse to patient ratios. That is by and large what people are fighting for, but workplace violence has also skyrocketed since the pandemic. there was another, was it a VA nurse? No, it was a San Francisco. There was a social worker, I believe, murdered at work, also a couple of weeks ago. There have been just a few high profile and terrifying deaths in hospitals. But of course, there's just assaults happening all of the time in these facilities.
You want to
So,
make some summary comments and then we'll go
okay,
to
we'll do.
questions. Thank you.
So, needless to say, I would say I hope I've made the case that the kind of lens that unionized healthcare provides into the healthcare industry, I think is a really important one for understanding what is happening in healthcare and why it is in such dire condition. If we're not able to retain healthcare workers in those places, then obviously uh, healthcare suffers. So I really encourage folks, when labor struggles are happening, please support them as you can. Nurses and healthcare workers are also on the front lines of fighting back against AI in healthcare, other sort of like technology that is being used to try and supplant actual having healthcare workers care for you at the bedside and putting you in front of iPads and such. But also just being able to fight for the kinds of wages and benefits that retain quality providers and keep people in the industry, as well as that kind of staffing, which oftentimes staffing is a smaller part of a much larger fighting for investment in facilities and staff. But ultimately, it does come down to the patient and the healthcare community. So happy to answer questions about how people can support, et cetera. But yeah, thank you for letting me talk.
Thank you so much, Sarah. As I did before, I'm going to start with one question and then we'll get to one questions from the audience, and then we'll move on to Dr. Shah. My same question that I asked for Suzanne, if you could tell me one funny story of any sort that you dealt with in dealing with some of the labor union work that you've done over all these years.
Oh, oh gosh, I thought,
And if you don't feel comfortable or
yeah.
think of
Well,
one,
I can't think of something funny that wouldn't require like a lot of backstory to
okay,
explain, but I do have a joyful moment
please.
that I would love to share,
Let's,
which is
let's go to here's joyful moment right now.
that's what I can share as a joyful moment that keeps me going. But in particular, so I've been a fan of Labor Notes, my organization, since before I worked there. I've been going to the conferences for many years, and they're always a high point for me, especially as organizing, which I also did as a career, is tough work. And so it's really beautiful to be able to come together with thousands of other organizers and activists and feel that joy together. And at our 2024 conference, it happened to be scheduled the same weekend as there was going to be a really important vote at the Chattanooga Volkswagen auto plant in Chattanooga, Tennessee. And the UAW, which was helmed by by a new reform president, Sean Fain. I don't know if folks tracked this in the news, but we did a small part to help him get elected and support his caucus of reformers. And at our conference, the Friday of our conference was the vote count for the union election. And so we were having a party that night, and to hear the vote count come down in a room full of labor activists to win that election was getting chills thinking about it again. It was just a really beautiful moment. And then a couple of days later, Sean arrived, the president of the UAW and some Chattanooga auto workers arrived at our conference to celebrate and to speak. And he got to address the conference and thank Labor Notes for our role in supporting it and supporting him. And anyway, that's a moment I'll probably never forget. So
Thank you so much. What I'm going to do, Sarah, in the interest of time, is ask you to look at the chat and respond. There's a couple questions that are specific, and I want everybody to consider supporting Labor Notes. I've been a supporter of Labor Notes for more than 30 years. And so I just want everybody to know that Labor Notes is one of my go-to magazines that I'm so happy whenever I receive their monthly newsletter. And I definitely encourage people to consider supporting Labor Notes. So please
We appreciate
respond.
that.
Please respond to the important questions that have been posed.
Absolutely.
Now, I want to say truly thanks to Nirav Shah. I called him literally at 9:30 last night, uh, and well, actually, I texted him because at 9:30 I would not call anybody, at least at my age. But he responded right away, and I asked him if he could, if he was any chance that he could appear because the we always have one congressional candidate or a political candidate, and that candidate backed out. So I want to introduce Nirav, who I've known for a number of years. He's a proven leader, and he's an attorney, epidemiologist, and economist. He, in 2019, Governor Mills appointed Nirav as director of the Maine Center for Disease Control and Prevention, where he rebuilt a critical agency and led Maine's public health response through unprecedented challenges of the COVID-19 pandemic. I want to have Nirav really take the rest of the time. So basically, just so you know, Nirav, one of the things that I always do is I start pretty much on time, but I always end on time. So out of respectful for everybody. So you can speak to like 8:20 or so we can have some questions, or 8:23. So speak for 10 minutes, and then we'll open it up for questions. Uh, Dr. Shah is a gubernatorial candidate in Maine. We welcome you. Thank you so much for joining, Nirav. We were going to have you in March, but it's a joyful to have you earlier. Thank you again, Nirav.
Well, I am so delighted to be able to join everyone this evening. Norbert, I'm glad that you texted me because I'm eager to chat with everybody. So I'm so glad that it worked out, and thank you for this forum. What I'd like to do is I'm going to try to talk less and leave as much time as possible for dialogue. And discussion and Q&A. That's where I think the real richness of these conversations is. And so I am, in very abbreviated fashion, going to share just a wee bit about my background, but most importantly, what are the issues that we here in Maine are facing that compelled me to run in this particular moment for governor, and then again, as much time as possible for Q&A. In short, I grew up in a small rural town, and then found myself in Chicago for much of my education. And after graduate school at the University of Chicago, where, as Norbert alluded to, I went to both law school and medical school. I practiced law for a number of years, which was incredibly important as a professional development matter, learning how to argue cases and things of that nature. Tremendous training. But something was missing, and that something was public service. And so when the opportunity came to join the government and serve, I jumped at the opportunity. And it was those years of experience in public service, working with labor unions, working with healthcare providers, working with folks across different ideological spectra, that I really developed the chops that ultimately proved useful when the pandemic came along. We here in Maine were affected, as was the rest of the country, but because of a lot of the skills that my team and I had developed, i.e., being prepared in advance, trying to lay the groundwork to combat misinformation before the foundation hardens, things of that nature. Maine was able to weather the pandemic and indeed achieved a higher vaccination rate and the lowest age-adjusted death rate of any state in the nation, something we're tremendously proud of. Um, the Biden administration then asked me to serve, and I was the number two official, and then for a while, the acting director at the US CDC. A tremendous education in leadership, a massive organization, actually bigger than the state of Maine government, both in terms of its number of employees and its budget. And so, really difficult life or death situations in some of the most complicated and challenging situations imaginable. Served and then came back to Maine after the administration changed and was approached to think about running for office. And my initial response to the friends who asked me to think about it was, are we not friends? I mean, why would you think this is a good idea for anyone? But as I thought about what was happening in the country, not only did I want to serve in the public on an ongoing basis, I realized that in light of the destruction that Donald Trump and RFK, to say nothing of the rest of the cabinet, were visiting upon the United States, the only way in which, in this moment, our health, our safety, our welfare, and our rights would be protected would be through governors and the state governments that they lead. And so that is why 14 weeks and 1 day ago, I declared my candidacy to be the next governor of Maine. I am tremendously excited to be doing this. More importantly, and why I'm so honored to be able to join everybody, if you detect a bit of a pep in my step, it is because yesterday the latest polling on the state of the race came out, and I am ahead by 22 points among the Democratic field. And just today, we announced that I am the first candidate to collect the requisite number of signatures to be on the ballot. You need 2,000 signatures in Maine. We collected 3,000, and we did it before anybody else with an all volunteer force of folks who fanned out across the state, something that gratifies and warms my heart. So we feel like we have a strong foundation going into the remainder of the primary. And the issues that I am focused about are ones that I think will resonate with this audience. My priorities in this moment are to feed kids, to fund healthcare, to fix the housing crisis, and to fight back against the Trump administration. There is much more to be done than that. But if you ask me right now, what am I going to spend my first day in office focused on? It's going to be those issues. So I am so honored to be here with everybody. As Norbert indicated, because I'm a candidate, I'd be remiss if I didn't ask folks to take a look at my website, which is shawformaine.com. I'm going to drop it in the chat here. And if after taking a look and after the discussion this evening, you are open to joining the campaign as a contributor, I would be tremendously honored. As I mentioned, we are up 22 points in the polls and are the first campaign that had the momentum and the grassroots support to get on the ballot. With your support, we'll be able to take this thing home. So thank you all for the opportunity. Norbert, I got in the 6 minute mark, so I'm going to turn it back to you, and I can't wait for the Q&A.
Okay, well, I'm sure that there'll be some questions. As I alluded, as I said that I would, I have two questions. One, the lighthearted question, and then not so lighthearted, but one that I'm sure that there are people in Maine, since this is recorded, uh, people in Maine will pay attention to. So the first thing is, COVID was such a difficult time. It was stressful for me. Many of my patients died. Uh, and but tell us, one funny thing that happened while you were head of DPH during COVID.
Norbert, I love that question because it's important to recognize that even in times of darkness, there can be light. And we must acknowledge that even in the darkest days, we all have to take a moment to laugh. Otherwise, we'll only cry. And so I appreciate the invitation to share. I'm going to share two really quick lighthearted moments. One of the initial briefings that I provided for the senior officials in the state of Maine government was in very early January. It was January 5th of 2020. And because of work that I had done earlier in my career in Asia, I still had a lot of connections with folks working in China, and they'd given all of us a heads up as to what was unfolding. And so I briefed my superiors here in the state of Maine and about what was unfolding in China and how we needed to get ready and buy PPE, et cetera. And as I was moving through my remarks, a young staffer somewhat sheepishly raised their hand and said, "Do you mean China, Maine?" Which is a little town of about 150 people or so on a big day. And I said, "No, this is China, China. That's the scope of what we're talking about." The other sort of crazy thing in the world is that, believe it or not, there is another person in the United States named Nirav Shah, named Dr. Nirav Shah, who
That,
also
that's how
works
we
in
that's
public
how we
health.
met. And that's
Yes,
how we met.
Yeah, indeed. He is the former state health official in New York and then has now gone out to California. He and I have been good friends for a number of years, but early on in the pandemic, before folks had seen me, there was in the AP, or it was either in the Washington Post or the AP, had a somewhat negative story about me, which is politics, and that's how it goes, and you get a thick skin. It was a pretty negative story about me pretty early on. And but instead of using my picture, they used the other Nirav Shah's picture, and so we just let it go. We didn't bother correcting them. So.
That's
Um,
a good story. And I'm sure you don't remember, but that's actually how we met because I know the other Nirav Shah. And so I said, I came up to you at a meeting when we started Ask Nurses and Doctors in 2018, shortly after that. And I said, I'm really confused. You don't look like the Nirav Shah that I knew from New York. Yeah.
Yeah.
You said,
Yeah.
well, I'm not that guy.
And different guy. Happens all the time though. And he and I get emails for each other and we have a running joke about it. And he and I go way back, back to the time when I was the state health official in another state. He was in New York. So we are very good natured about it. I will send him a text here in a minute and let him know you say hi, Norbert.
And I just want to highlight the Foster Gueston put in the chat that he used to work for the Nirav Shah in New York. So before
Yep.
I go to Connie Adler's question, I want to ask a more serious question that I'm sure is going to be in the minds of people in Maine as they decide, who to vote for. So it's sort of a combination of, especially in states like Maine, but certainly also in Massachusetts, you really haven't, quote unquote, lived in Maine long enough. This is your first run for public office. You're kind of a newbie. So how do you respond to those kinds of comments, which, as despite the polls and so on and so forth, you're that how do you respond to those kinds of sentiments, which, as you know, as I was about to say, are in the back of people's minds. So even if people are possibly inclined to support you, but there's people who say, who is this guy? He's never run for office and he's hardly lived in Maine. And how do you respond, Nirav?
Well, the fact is, Mainers have seen me in action in a time of crisis, and they saw me show up for them over 322 live press conferences, hundreds of radio appearances. Many Mainers know my voice, they know my dog's name, they know me as they would a member of their family. And more importantly, they've seen how I comport myself in difficult and stressful situations. And that matters much more than whether I grew up in the right county or the right part of the state or even the right part of the country. And those poll numbers bear that out. To the extent there is any residual concern about that, the fact that Mainers have gotten to know me so well over the years is quite helpful. But the other piece, Norbert, is that in this political moment, those are as much assets as they are liabilities. And indeed, what I hear over and over and over again is that folks are looking for somebody who is not tethered to Augusta or has not been part of the establishment for a long time. And so, will there be some segment of folks who say, if only that guy had been a legislator for 20 years? Of course, without a doubt, there will be those folks. But in this moment, the appetite is for folks of my background who are going to come at this without being beholden to others. To put it simply, Norbert, I'm nobody that nobody sent. And that means when I make decisions, I am not beholden to anybody.
Okay. Well, within that framework, there's at least one person from Maine. I'm so pleased that Connie Adler will be the first person to ask a question. Go for it, and then there's some questions in the chat, but it's absolutely appropriate for Connie to be the first person because she's from Maine.
Sorry, I had a minute there for it. First of all, I did want to say a thing that you did not talk about in your summary of yourself is what an incredible communicator you are. And that was so important during the pandemic. I mean, there were so many people hanging on your words, and you were on the radio daily, and so I just wanted to say that that was really important, and we appreciated it a lot. My question was about primary care. Um, there is a dearth of primary care providers especially in rural areas. I'm in Farmington. Um, and I know you know others of us from the Farmington area. The that so access to primary care is a
Yeah.
critical problem right now, and so I'm just interested in what your thoughts are about how to address that issue.
Yes.
We
Well,
have
thank you.
we have
And
2 minutes left. This is a 2 minute.
Okay, I'll try to do it in a minute, Connie.
Right.
I'm going to be this is a critical issue to be as this group knows. Primary care is the base of the pyramid. When you really peel back the onion as to what is holding back development of a primary care workforce in Maine, when you really distill it, it's the fact that there are not enough clerkship opportunities at healthcare facilities. That is a very wonky answer, but it is the rate limiting factor as to why there are not more nurses, PAs, nurse practitioners, and physicians. It's just that there are not enough clinical spots for them to be trained in. We have great med schools, but when those folks need to go on the wards for their rotations and their practicums, there are not enough spots. This is where Augusta can help. Augusta, through the legislature and the governor's office, can set aside funding for Maine General and Franklin Memorial and places like that in your neck of the woods to be able to accommodate more trainees. Where people do their clinical training is where they will often stay afterwards. And so that is the surest pathway to sustaining a bigger workforce in primary care.
Thank you.
Mhm.
Hey, it's 8:29. I'm gonna just ask very quickly, what other additional healthcare issues will you emphasize? And then I'm sure that Nirav will be happy to respond to the other questions. There's several other questions in the chat, and I'll include that in the email that I'll send out. Could you
Great.
send out?
In the last 10 seconds, we talked about primary care. The other is prescription drug prices. And then the third are copays and deductibles, which are eating up more and more and more of people's households' incomes. I would cap those as a function of people's household income. So no more than 2% or so of your annual income going toward copays and deductibles.
I've written down all the questions. Thank you so much to everybody for joining. Thank you to Sarah Hughes. Thank you to Nirav Shah. Thank you to Suzanne Gordon, who's not with us. It's just great. Stay tuned for the next episode, which will be sometime in February, and we'll for sure be having more and more people join. Thank you so much. Bye bye now, and have a good evening.
Thanks, everyone.